Hi, everyone. I'm Kara Sundlin joining you now with some new news that's really important for our region. Connecticut Children's is expanding. A $280 million plan will change the Hartford campus. And joining us now for more on how these plans and how these new services could really help your family in the future is Ryan Calhoun. He is the Vice President of Strategy and Care Integration from Connecticut Children. Thanks for being with us, Ryan.
Thank you for having me.
You know, one of the things that I noticed could be huge for this region and really put CCMC on the map even more would be this new fetal care unit. Can you tell us about what you'll be adding and how it's going to save lives?
Yes, absolutely. So we have been working very diligently to be able to bring a fetal care center to Connecticut Children's. And the first puzzle piece to that was being able to recruit a world-class surgeon in Dr. Timothy Crumblehome, who is one of the pioneers of this type of fetal care surgery that will really allow us to improve the survival rate for those mothers who are going to have children with fetal anomalies. And so we're very excited to be able to bring this type of program. There are only a few of these throughout the country. And so to be able to provide this type of service here in Connecticut will prevent mothers from having to go outside of the state for this type of service, and will continue to allow us to be more of a destination of care as we continue to become for the community.
Yeah, and it's even become a destination, I know, for people outside other states to come to us. What about mental health? That's been such a problem, especially since the pandemic for young people. I understand this new expansion will allow you to do even better care for behavioral health.
Yes, absolutely. So as everyone knows, there has been somewhat of a second pandemic with behavioral health, and it's been a large challenge for our children in the area and across the country. And so we are very committed to be able to provide a full behavioral health continuum. One of those is building a new inpatient med psych unit, which will be going inside of the hospital. And then this tower in particular is going to allow us to expand our capacity for more care throughout the system for behavioral health care patients. And so we know that this demand is only going to continue to increase, but we are working as hard as we can to try to be able to serve children throughout the continuum, whether they are in our hospital or in the community, to prevent them from getting to the hospital. But if they need us, we do want to make sure we have that service for them.
And just finally, quickly, will it help women who are giving birth?
Absolutely. So, we are very focused on being able to expand our neonatal services. So one of the bigger areas that we have continued to see growth is in our neonatal intensive care unit. And so adding 50 beds to that in our current neonatal service with private rooms is critically important to be able to provide the level of care that we believe that all mothers deserve for their children to be able to have babies, and especially when they are premature like that, they'll be able to get the best care with the best specialists inside of the new tower.
Yeah, that's great for everyone to hear, and we're excited to bring that information. Just to get a little bit more information for those who are joining us on our streaming network right now, how long is this going to take? Like, when do you think it'll actually be finished and people can actually start getting services?
Yeah, so right now we are in the design phase, and so we believe that design phase will continue for the next year or so. We hope to put a shovel in the ground next year if we can get all of the approvals, which is why we put in the certificate of need application. And then we would hope to be able to finish construction in 2025 so that we could open up this new tower at the end of 2025.
And you do get a lot of folks coming, not just from Connecticut, right? I understand because of the standard of care, you are now becoming a destination for people who may even live in Massachusetts or New York or Rhode Island.
Absolutely. And so we see patients from all 50 states and multiple countries. It's just the nature of the specialists that we've been able to recruit, and the demand continues to grow for our services and for our expertise. And we have sites not just here in Connecticut. We have units in New York through partnership with Nuvance. We have an ambulatory campus in Massachusetts. And so we continue to be more of a regional destination of care and not just a local destination of care. And so we know that will continue as we continue to bring other services like a new fetal care center, like a new bone marrow transplant unit, as well as other services to the area. So we know we'll continue to be a regional destination for pediatric care.
And also, you have a Fairfield destination as well, and I understand that your Westport location is going to get even bigger as well.
Absolutely. So we have had a strong focus on one, becoming a regional destination, but also making sure that we're going to where kids are migrating. So the lower part of the state, we know, has had a lot of population growth for children. And we have heard loud and clear from pediatricians in that area that they want our expertise. And so we are expanding our services with a large Westport campus that will be opening at the end of the year. It should be about 16,000 square feet with more than 15 different specialties that will be there. So we continue to bring more care close to home, which is a big part of our strategy. We want to keep as much lower acuity care as we can in the community. And we want to make it to where they only need to come to the hospital for the most acute services that we can't provide anywhere else but a tertiary hospital like ours.
Well, Ryan, we appreciate you being with us. I know this is going to be the largest ever expansion of the Hartford campus, so we'll, I'm sure, be doing more and more stories as this happens, as Connecticut Children's continues to grow. But thank you for sharing this monumental news with us here today.
Thank you.
And you can learn more about all of this on Eyewitness News starting at 4. I'm Kara Sundlin, and thanks for watching us on our streaming channel, WFSB Plus. You can also, of course, follow us on social media.